There is a baby in Osaka tonight, wearing the same brand of diaper your baby wears, drinking the same formula, and his bottom is smooth as a river stone. In 11 years of practice in Japan, I saw one bad diaper rash a week, if that. And in my first week back in an American clinic, I saw 11. Same babies, same diapers, same everything. So what is happening at that changing table that nobody here is telling you? It is 2 in the morning. The house is quiet. You have the little lamp on over the changing table, and you are looking down at your son, and he is bright red from the top of his legs to the small of his back. Raw, shiny in the worst spots, broken skin, down in the crease where the thigh meets the hip. He is screaming, the kind of scream that is not hunger and is not tired. It is pain. And every time you touch him with the wipe, he arches his back and screams louder, so you go slower. And going slower makes it last longer, and by the time you get the clean diaper under him, you are both crying. There are 4 tubes of cream on the shelf behind you. You bought all 4. The white one, the thicker white one, the one the pharmacist said was better, and the one your mother-in-law brought over in her purse. None of them worked. You have been at this 9 days. My name is Dr. Peter Hale. I am a pediatrician. I have been one for 22 years. 11 of those years I practiced in Japan. Most of them in a clinic in Osaka, seeing Japanese babies and the babies of foreign families all day long. And I want to tell you about something it took me almost a year to notice, because it was the absence of a thing, and absences are hard to see. I almost never saw diaper rash. Not never. I will be straight with you about that word later, because the title on this video is a little louder than the truth. But in a full week of clinic in Osaka, I might see one bottom that needed real treatment. Back here I saw 11 in 5 days. Same age babies, many of them in the exact same brand of diaper, because the Japanese brands ship all over the world now. Same formula, same weather. One difference. And I did not learn it out of a textbook. I learned it because of my own son. He was 5 weeks old. I was a board-certified pediatrician with a wall full of paper, and I gave my own child a rash so bad it bled. Quick word before I go further. The old methods my family uses, there is more of it than fits in any one video. I gathered the whole of it into a book you can buy in our pinned comment below. The book is the long version. If you want it, it is there. I will not mention it again. I sat on the bathroom floor at midnight with a bleeding baby, and I could not tell you what I was doing wrong, because I was doing everything the book said. Change him often. Keep him clean. Use the wipes. Dry him well. Cream at every change. I was doing all of it. I was doing it perfectly. That was the problem. I was doing it perfectly. Here is what nobody says out loud in the exam room. Diaper rash is the most common skin problem in babies on Earth. The surveys put it somewhere between 1/4 and half of all babies in diapers having some degree of it at any given moment. It is not rare. It is not a sign you are a bad parent. It is not a sign your house is dirty. And I want you to hear that from a doctor, because I have watched hundreds of mothers sit in my office and apologize to me for their baby's bottom like they had confessed to something. You did not do this, but you can undo it, and it does not cost $40 in creams, and it does not take 9 days. In my experience, it takes about 72 hours, and most of what fixes it is free. So what were the mothers in that Osaka clinic doing at 2 in the morning that we are not? Let me tell you what is actually happening on your baby's skin, because once you see it, you will never look at a changing table the same way again. Everybody thinks diaper rash is a wetness problem. Wet skin, red skin. That is what the diaper commercials sell you. And that is why every diaper on the shelf is advertised by how much liquid it will hold. Wetness is part of it. It is not the main part. Here is the real thing. Your baby's skin has a coating on it. Doctors call it the acid mantle. It sits at about a 5.5 on the pH scale, which means it is slightly acid, like a mild vinegar. And that acid is what keeps bacteria out and keeps water in. It is the whole defense. Now put urine and stool in a closed bag against that skin. Not urine alone, not stool alone, both together. There are bacteria in stool that carry something called urease, and urease breaks urine down into ammonia. Ammonia is alkaline. It pushes that skin from a 5.5 up to a 7 and 8. And here is the part that made me sit down when I finally understood it. Stool also contains digestive enzymes, protease and lipase. Those are the same enzymes that broke down the milk in his stomach an hour ago. They are asleep in an acid environment. They wake up in an alkaline one. So the ammonia raises the pH, and the raised pH switches on the enzymes, and those enzymes start doing the only job they know how to do. They start digesting. They cannot tell the difference between a protein in a meal and a protein in your baby's skin. So your baby is not sitting in something that irritates him. He is sitting in something that is slowly eating him. That is the counterintuitive truth. Diaper rash is not a wetness problem, and it is not a hygiene problem. It is a chemistry problem. And the whole reason it will not heal is that you keep making the chemistry worse, trying to make it better. Because what do you do when he is red? You clean him harder. You use more wipes. You scrub the folds. And the wipe is the thing that is hurting him. Look at a package of standard baby wipes and read the back. Fragrance, preservatives, alcohol in the cheap ones. Then feel the wipe itself. It is a piece of dry cloth soaked in liquid, and when you drag it across skin whose barrier is already broken, you are doing two things at once. You are wiping away the last of the natural oils, and you are causing friction on inflamed skin. Friction is the third leg of this. The chemistry breaks the barrier, the moisture softens it, and the rubbing takes it off. That is the whole disease in one sentence. Now here is the contrast that ought to bother you. Look at what a bad month of this costs. 4 creams at $8 to $12 each. A bigger box of the sensitive wipes. Pediatrician visit, maybe an urgent care visit at 2 in the morning if it looks infected, and it often does. $300 is easy. And the thing that fixes it, the single object that changed everything for me, costs about $6. And you can buy it in the aisle where they keep the nursing pads. It is a plastic squeeze bottle. That is it. That is the secret weapon, a squeeze bottle. Because the mothers I watched in Osaka were not wiping, they were rinsing. There is a whole culture there built around washing with warm water instead of paper. It is in their toilets, it is in their bathhouses, it is in how they were raised, and it goes right onto the changing table without anybody thinking of it as a technique. It was not a method to them, it was just how you clean a person. And nobody sells it to you here. Because you cannot sell a mother a $6 bottle every month. You can sell her wipes every month. You can sell her cream every month. Nobody is going to run a commercial telling you the answer is warm tap water. All right, here's exactly what I want you to do, in the order I do it, and I want you to start at the very next change tonight. Step 1 is the rinse. Get a Perry bottle, that squeeze bottle with the angled neck, $6 to $8 at any pharmacy. Fill it with plain warm water. Test it on the inside of your own wrist, the same way you test a bottle of milk. Body temperature, not hot. Now here's the trick, and this is the one people rewind for. Do not take the dirty diaper out from under him first. Undo the tabs. Wipe away the bulk of the stool with the front of that same diaper. Then fold it down and leave it under his bottom like a tray. Now squeeze the warm water over him and let the old diaper catch every drop of it. You do not need a sink. You do not need to carry a screaming baby to the tub at 2 in the morning. The diaper is the sink. Then slide the whole wet mess out and set it aside. Step 2 is the pat. Never the wipe. Take a soft cotton cloth or a plain cotton square and pat him dry. Pat, do not drag. Get down into the creases with the corner of the cloth, because the creases are where it always starts, and pat them dry too. If he is red and broken, do not touch the raw part at all. Just water and air on that part. Step 3 is the air, and this is the step everybody skips, and it is the one that heals him. Leave him bare for 2 minutes. Set a timer if you have to. Lay him on a waterproof pad with a folded towel over it and let his skin see the room. 2 minutes, twice a day, is enough to change the whole picture in 3 days. If you can manage 10 minutes in the morning while you have your coffee, better still. Yes, he might pee on the towel. That is what the towel is for. Step 4 is the barrier, and this is where most parents go wrong in a way that seems generous. You need zinc oxide. Get the strong one, 40%, the kind that says maximum strength on the tube. Boudreaux's butt paste maximum strength and Desitin maximum strength are both 40%, and both are about $10. Plain petroleum jelly works too, and costs $4. Now the trick, do not rub it in. This is not lotion. You are not moisturizing him. You are building a roof. Put it on thick, like you are frosting a cake, thick enough that you cannot see skin through it. And at the next change, when the top is soiled, rinse the soiled part off gently, and then put fresh paste right on top of what is still there. Do not scrub the old layer off. That scrubbing is the thing that is keeping him raw. The paste is supposed to stay. Step 5 is the clock. In Japan, I watched mothers change babies far more often than parents do here. And part of that is that the diapers over there almost all have a wetness line on the outside that turns blue the moment it is wet, so you are not guessing. If your brand has that line, use it. If it does not, work on 2 hours while he is awake, and immediately after any stool, no matter what time it is and no matter how quietly he is sleeping. Stool is the one you never let sit. A wet diaper is a slow problem. A dirty diaper is a fast one. Step 6 is the fit, and this one takes 10 seconds. You should be able to get 2 fingers flat under the waistband. If you cannot, it is too tight, and tight means friction and no airflow. And run your finger around the leg cuffs after every change to pull the ruffled edge out, not tucked in. Tucked cuffs leak, and they chafe. 2 seconds. Do it every time. Now, step 7, and this is the one that will save you a wasted week. Know when it is not a rash. If the red is bright, almost beefy, with a sharp defined edge, and there are little separate red dots scattered out beyond the main patch like sparks off a fire, that is yeast. Candida. It lives in the creases, and it laughs at zinc oxide. No barrier cream on earth will clear it. It needs an antifungal, and it needs your doctor to look at it. Same for anything with blisters, anything oozing yellow crust, anything with a fever, anything with blood, and anything at all that is not clearly better in 3 days of doing what I just told you. Go be seen. And while I am here, 3 things not to do. No talcum powder, ever, because babies breathe it in, and it is not worth the risk for something that does not work anyway. No hydrocortisone unless a doctor tells you to, because a diaper is an occlusive dressing, and a steroid under an occlusive dressing on infant skin is a different drug than it is on your arm. And no vinegar, no baking soda, no home soaks off the internet. You are trying to leave the chemistry alone, not add to it. So let me zoom out, because this is bigger than a red bottom. When a baby's skin is broken, he does not sleep. When he does not sleep, you do not sleep. And I have sat across from more exhausted mothers than I can count, who came in about a rash and ended up crying about their marriage, or their job, or the fact that they no longer recognize themselves. A diaper rash at week 3 of a new baby's life is not a small thing. It is the thing that breaks a family's sleep at the exact moment they have nothing left to give. And there is a second cost that nobody talks about, which is the guilt. Every one of those mothers thought the rash was proof of something about her. It is not. Now let me keep my promise about the title. Japanese babies do get diaper rash. Of course they do. There are dermatology clinics in Tokyo full of babies with sore bottoms, and there are Japanese mothers standing over changing tables at 2 in the morning, feeling exactly what you are feeling. I am not going to sit here and sell you a fairy tale about a country where nothing goes wrong. What I can tell you honestly is what I saw with my own eyes over 11 years, which is that it came through my door far less often. And when it did, it was milder and it cleared faster. And when I finally started asking the mothers what they did, the answers were boring. They rinsed instead of wiped. They changed the second there was stool. They let the baby air out after the evening bath. They used a thin, plain ointment, and they did not fuss at the skin. That is the whole of it. There was no secret product. There was no ancient herb. There was a set of small habits that nobody had ever bothered to write down because they were too ordinary to write down. And that is the part I want you to take with you. The best medicine in pediatrics is almost never the expensive thing. It is the ordinary thing done consistently by somebody who loves the patient. I have 30 years of training, and I could not fix my own son's bottom until I stopped treating him and started leaving him alone. Here is the line an old nurse gave me in my first year in Osaka, and I have repeated it to parents ever since. She watched me scrubbing at a baby's creases, and she took the cloth out of my hand and she said, "His skin is not dirty, it is new." That is it. That is the whole video. His skin is not dirty, it is new. You are not cleaning a floor. You are protecting a barrier that is thinner than the paper this is printed on, and that took 9 months to build. So here is what I want you to do tonight. At the very next change, before you go to bed, no wipe. Warm water from a cup or a squeeze bottle poured over him while the old diaper is still underneath to catch it. Pat him dry with a cotton cloth. Do not drag. 2 minutes bare on a towel. Then zinc oxide, 40%. Spread on thick like frosting and do not rub it in. That is 4 steps, and it will take you 90 seconds longer than what you did last time. Do that at every change for 3 days, and I want you to come back and tell me what his bottom looks like on day 3. Put it in the comments below. Tell me your baby's age, tell me where you are watching from, and tell me if the redness went down. I read them, I answer the ones I can. And if it is not better in 3 days, or if you see those scattered dots out past the edge of the red, stop guessing and get him seen, because that is a different animal, and you will not win it with cream. Next time, I am going to show you what those same Osaka mothers do about cradle cap. that yellow crust on the scalp that everybody tells you to leave alone. There is a kitchen oil you probably already have, 10 minutes of waiting, and a comb with teeth set closer together than you would think is safe, and the crust lifts off in sheets without ever pulling a hair. Nobody taught me that in medical school either. Until then, go slower, wipe less, and remember that the newest skin in your house is not a mess to be cleaned. It is a thing to be guarded.